Hello everyone, welcome to this video. We're producing this to help community pharmacy contractors to go ahead and to make expressions of interest on the Covid-19 vaccination phase 3 booster programme. With us today, you've got Bruce Prentice, our clinical advisor from NHS England and Improvement, myself, Adam Irvine from Community Pharmacy Cheshire and Wirral, and we're also joined by Kath Goulson, who's the CEO of Community Pharmacy Lancashire. I'm going to hand over to Kath now, who's going to talk us through the intro session and the agenda. So over to you, Kath.
Thank you, Adam. So what we're going to look at today is going to give you a summary of the service, give you the key features of the community pharmacy service itself, the timelines that everybody will be working to, completing your expressions of interest, any question and answers that you may have, and then signpost you to the resources that can help you in your expression of interest. So in summary, the expression of interest process is now open, and this allows pharmacists who wish to be considered for phase 3 to inform their regional team by submitting an expression of interest via the portal by 5 p.m. on Wednesday, the 28th of July. So our suggestion would be that contractors carefully consider all the information in their documents before submitting their expression of interest. Now, this is a new service, and so community pharmacy contractors currently delivering COVID vaccinations and in phases 1 and 2 will need to follow the same expression of interest process. So they too will need to submit a phase 3 expression of interest. Regional teams will then prioritise the expressions of interest, taking into account the population need and access within their certain populations. So the key features of the community pharmacy LES. There's going to be a transition from phase 2 to phase 3 for some contractors, because to allow those existing sites that are already offering vaccinations, their LES for delivering phase 1 and 2 is going to be extended until the 31st of October. Yet these community sites will not be able to deliver the booster vaccinations. Site capacity options. So this has been piloted, and it's found that community pharmacy contractors can now express interest in being commissioned to deliver COVID-19 vaccines from a low capacity site, in addition to the previous medium and large option volumes. And in terms of indemnity, the government is working closely with the insurance sector to provide support to pharmacy contractors commissioned to deliver phase 3. So payments. The item of service fee will continue to be £12.58 per vaccine administered. In addition, a payment of £10 will be made for the administration of each vaccination to each patient where the patient is resident and receives a vaccination at a care home or other residential setting, employed or engaged by a care home and receives vaccination at that care home or other residential setting. For administration of each vaccine to each household patient, those 3 criteria need to be met to get the payment of the additional payment of £10. So timelines. The expressions of interest from pharmacy contractors is already open, and at 5 p.m. on the 28th of July, the portal will close. So that is your deadline to put your EoIs into the system. From the 28th of July to the 4th of August, the Commissioner is going to be looking at the expressions of interest. From the 5th of August, and additional dates if needed, then that been asked for further expressions of interest from pharmacy contractors if the needs of the localities have not been met. Rolling through August, there'll be assurance of the proposed sites to confirm that these sites meet the ICS needs and should be commissioned. Rolling through August and the assurance plus 1 week, there'll be readiness preparation before a site designation meeting. And then rolling through August, site designation meetings with contractors to approve the assure sites who've completed their readiness assessments. The table then talks about group 1 and 2 sites, and these sites will be allocated vaccine, will be able to schedule clinics and make vaccination appointments live, all with a view to the designated sites going live in September.
Well, thanks, Kath. So in terms of the designation process, I thought it'd be helpful just to go through and to explain it. So we've got possibly the most complicated looking diagram possible on the screen. However, actually, when you work through it, it makes a lot of sense and it goes through, and it matches the timelines Kath's just gone through. So just to follow it through from the top, the designation process and the draft LES have been published. So contractors are currently being asked to express their interest based on those processes. Once they're received in, so the first of the boxes with a red marker on, those sites will be reviewed, and the sites that are deemed to be priorities based on the population need, they will be taken forward as priority sites. The idea of a column on the NHS England side, the right-hand side, is really a journey through the designation process so we can really clearly see how a site progresses. They then, once they're a priority site, that goes through an assurance process to make sure they can actually deliver what they're able to deliver and the commissioner is comfortable, and then they move forward to being an assured site, and then it moves further forward to be a designated site once everything's matched and the readiness is assumed to be the case. At all of those elements, there is an assurance process or the communication with the pharmacy contractors involved. And actually, at either of the first two steps, either the priority site designation or the assured site designation, if there seems to be a need, if the ICS or the population need locally deem there to be a need, there's an opportunity, like they did with phase 2, for NHS England to go out and to say, these are the areas we're currently struggling with, where we've not got enough vaccination processes to do, and there can be a more targeted EoI to come out. So that's how we'll see it. Once you've gone through that designation program and you come out the other side as a designated site, there'll be a program setup support, some equipment deliveries, if it's appropriate to you, will arrive, and that depends on the volume you'll be doing as to what that looks like. And then once you've signed the contract, you've done the training and the preparation that's been signed off, you can then go ahead and offer vaccines on the national booking system, vaccination appointments on the national booking system, and go ahead. Couple of things just to talk around the sites. As Kath shared at the earlier slide, there's different sites this time. So we've got the low volume sites delivering a minimum of 100 vaccinations per week, the medium volume sites delivering 350 vaccines per week, or the high volume where there are 1,000 and above per week. One thing that's slightly different from what we've seen previously is the low volume sites must be delivered on their NHS premises. The medium and the high, there's a strong preference for the NHS premises to minimise cost, but it's not a mandate. So it's whatever's appropriate for the population you serve and what the other opportunities are, and the other expression of interest are there. But that's certainly something to bear in mind. The equipment needs is slightly different. So if you're a low volume site, because it's happening on your NHS premises, the equipment provision will be minimal because you're actually already there and you're in a set up clinical site. Whereas a medium and a high, it would be appropriate to what that site needs and to the capacity that it needs. All the sites are required to source their own consumables, and all of them will use the national booking system to book their vaccines on. Exactly the same for clinical negligence, and the government have done a consultation recently, and there's some support going into insurance providers to make sure that as clinical sites you're able to gain insurance at appropriate rates, and that's all coming out, but it will be the provider responsibility for all of the COVID-19 vaccination sites to do the clinical negligence. Much like the equipment, the support for IT, the connectivity elements, if you're a low volume site, that will be minimal, because you're already an operating site. IT is present to a large degree. And if you're medium and high, it's very similar to the current LES. So it depends on the on-site location, whether it's an NHS or a non-NHS site. And it also depends on what's already there and what's already in process. And that will be gone through as part of that designation process with you. There is also a slight difference to the vaccine supply, especially if you're already an existing phase 1 or phase 2 site. You will have experienced that supply chain in a slightly different way. So this time, if you're a low volume site, it will be a fortnightly supply drop. If you're a medium or high site, it will continue to be a weekly one. So it is slightly different in that regard. I'm going to hand over to Bruce now to talk about completing the EoIs and some top tips there. Bruce, you muted.
Thanks very much, Adam. Thank you for joining us and for taking the time to understand about the expression of interest for phase 3 of the COVID vaccination programme. Just before I get started, I just wanted to touch on our experience so far with phase 1 and phase 2 of the programme. It's been highly successful. Our experience of community pharmacy delivering that service has been absolutely phenomenal. It's up to this point in the Northwest, over 1.5 COVID vaccines have actually been administered by the pharmacies that are in the programme. And this expression of interest is an opportunity for new pharmacies to join the programme. And the purpose of being here today is to encourage you to do so and to give you a point of contact that if you've got any information or you'd like to discuss it further, we'd love to hear from you. In short, we would like more pharmacies to come forward and be considered. So please do what you can, and if you are interested, make that expression of interest. In terms of things that you need to consider, I'm not going to read through the slides, but there are a number of aspects that if you do make it clear in your expression of interest that you've already considered those, it will make the process of being commissioned that much easier, because we won't have to come back to you or check. So the points that we need you to consider are, first and foremost, that if you do take part in this service, will you be able to meet your contractual requirements for your current contract? So what will the implications of you doing this work be in terms of the pharmaceutical services that you provide? If you join the scheme, will you also be able to meet the GPHC standards that are required? The pharmacies that have already taken part in phase 1 and phase 2 had no problem in achieving that. I'm sure that that will be the case for those of you that want to take part and express an interest in phase 3, but do bear that in mind. It's also important to think about infection control, because those are key elements that dictate whether or not a site is deemed suitable to provide the service. It's important to think about the competency of the staff to undertake the COVID vaccination programme, what level of staff that you've got that would be able to do the vaccination. Do they meet the requirements? Are they registrants? Are they going to be working to the pharmacy SOP or actually to the national protocol? What additional staff might you need to take on to deliver the service? Would you be having to supplement your existing staff, bearing in mind that you will also have to deal with the observation of patients post-vaccination and deal with measures to control the entry and exit to the premises. The premises itself, it's very important in aspects of governance around those premises, so you need to bear that in mind. Essentially, for a site to be selected, we need there to be very, very good governance to ensure overall patient safety and confidentiality. How patients will access the site is a key aspect for us. So that is the size of the site, how many patients you might be able to accommodate in your site, and whether or not you can maintain an adequate pharmaceutical service whilst you're taking part in this programme. What are the access routes to the pharmacy like? Is it conveniently located? And is there parking available to patients if you're going to have an extra 50 patients a day coming, for instance, if you were doing 350, to be able to access those services? There may be extra costs that you would incur in order to provide those services. So we need you to be clear of those within the expression of interest, and equally the same with equipment. If you're going to be off-site, we don't expect you to have agreements in place to secure that site, but we do need to know what those off-site locations might be. Other aspects that we'd think about relate to the mix of clinical staff, non-clinical staff involved in supervision, vaccination and observation, what staff you would have for the reception of patients and overall supervision of the site, what marshals you may need to guide patients prior to entry, what the arrangements are for marshalling in the car park, and managing queues and patients as they present themselves, maintaining social distance, and also making sure that the patient flows are adequately covered. As well as providing clinical oversight post-vaccination, need to think about how patients will know when to leave the site. So if it's a 15-minute observation period, then what's the processes that you would have in place to ensure that patients don't leave early or know exactly when to leave? Will you have sufficient space to maintain social distancing for post-vaccine observation? And who will actually do that observation? Who's the clinical lead that will be able to oversee that? What sort of decontamination processes would you have post-vaccination? And is there an exit route that is separate from the entry route, and is it clearly marked? Infection and prevention control is vital to the service. It relates to the normal aspects that you would expect, such as how to make sure that the site is clean and that there's sufficient space within the site to ensure social distancing. There are aspects that you need to consider in terms of the clinical supervision and how accessible they are to the patients. What space is there if staff are working side by side in a close proximity, and in terms of mask wearing by all staff, do you have policies and procedures that ensure that they are correctly worn and that there is good protection of the staff for infection control? We also need to think about the waste that would be generated by the service and where that will be stored within the pharmacy and the proximity to the patient. Service protocols, the service protocols aren't expected to be very different from what we have in phase 1 and phase 2. How familiar are you with those? Will your staff be following the national SOP for COVID vaccination or the national protocol? What would the opening hours be for the pharmacy? We're looking for sites that are capable of doing that 7 days a week. Is that suitable for your site? What levels of staffing will you have to take in place? How will you deal with surges in demand? What's your capacity overall? And how would you deal with unplanned closures?
Well, thanks for that, Bruce. So we've got a question and answer session here. Obviously, it's only myself and Kath on the line. So just if we can have a few questions for Bruce. First of all, from an assurance point of view, many contractors are thinking about the patients waiting post-vaccination. What's it look like from your assurance point of view on that post period, the socially distancing element of it, the mask wearing element of it? What are you wanting to see as part of the EoI there?
I think we want to see that sites have thought about the capacity that they are proposing to put through that site, be it 100 a week, 350 a week, or 1,000 a week. A calculation as to how many vaccinators they would have working at any one time and what that would mean in terms of number of individuals, therefore, that would have to be observed post-vaccination. It depends on a number of variables, but sites may have 4 people waiting every hour. Some sites may have 12 people waiting every hour. And it's just to work out show that you've thought about what space would actually be needed for that and how you can achieve that while maintaining a full pharmaceutical service.
Thanks, Bruce.
Bruce, I have a question. This is still remaining with patients coming into the pharmacy. What would you be looking for in terms of a patient walking in to get their prescription versus a patient walking in to come for a vaccination, and how the pharmacy manages those two people coming in for two very different services?
I think that's a really good question. And again, it depends on each individual site's capability. So some sites where they have separate entrances may want to direct flows in different ways. But it is very, very likely that patients who want to access the pharmaceutical services of the pharmacy will not want their service to be interrupted or delayed because of other activities that are happening within the pharmacy. So that is a concern, to make sure that, for instance, if the pharmacy would only have the capability of letting a certain number of people into a site at any one time, and the site already is full to that capacity with people who are being vaccinated, that might prevent the entrance of someone who wants to access the pharmaceutical services. So it is important. What some pharmacies have done in phase 1 and phase 2 is they've thought about the pharmacy layout, and they have created a zone within the pharmacy which is for the COVID vaccination service. Patients are met at the door and they're directed into a specific part of the pharmacy to access whatever services that they want. We'd be looking for a good degree of separation and for that to be explained in the EoI.
Thanks, Bruce. One thing I just wanted to come in with, there's a number of other resources and support. The links are in the description of this video. You can't click on the video to get to them, but I'll put them in the description below. So if you do want to have a look at any of these materials, they're there to help you. Ultimately, what we want to, if there's a contractor that's got any queries or got any concerns around this service, is to have a conversation. You know, that's what that's around. Bruce, are you happy for me to share your contact details on this video?
Yes, absolutely. The whole point of this is to encourage people to come forward. The expression of interest process might be new to a lot of you, and by all means, get in touch either by email or by telephone or through the LPC. You know, if you've got any questions, please get in touch. We want to see as many applications as we possibly can get.
Fantastic. Thank you, Bruce. So I think I just want to echo that, and I'm sure Kath will as well. Just as many applications. If you're interested in doing the service, we would love to see lots of applications across Cheshire and Merseyside, as well as Lancashire and South Cumbria. So thank you for all the help in putting this together. And any contractors, thank you for watching. Please get in touch if you've got any further queries.
Thanks very much, Kath and Adam.
Thank you.